little or no responsibility for the drop of inflation. Economists say that the factors that did help improve inflation include a decline in oil and gas prices from last year's peak, and the Fed's raising its interest rate, and the easing of supply chain issues that caused shortages coming from the crisis. But just this week, the Biden administration has officially launched a new income-driven payment program that's ahead of the repayments restarting this fall. The official launch of the SAVE program plans just weeks and will come into interest and will begin to accrue on student loans for the first time in more than 3 years in September. Repayments will resume in October, although no financial consequences will come to borrowers that are unable to pay for a year. Education Secretary told reporters that starting today, millions of borrowers can reduce their monthly student loan bills by enrolling in this plan, the most affordable repayment plan in history. It plans to stop and put a huge step forward in Biden's efforts to fix student loan system and reduce the burden of student debt in working families and put borrowers first. The launch of the SAVE plan comes after it helps in a beta testing phase for almost a month for individuals. Those who repay on the repay plan or apply for the SAVE plan do not need to fill out the application. Now, a senior administration official said that borrowers will also want to see the benefit of the SAVE payment plan before they even start repayments. Now, the Biden administration has also announced its outreach campaign to ensure borrowers are aware of the new plan, which officials say will save borrowers millions of dollars. The campaign will work in partnership with numerous organizations to make borrowers aware of this plan. It will be a two-phase rollout at some of the programs, and this year the income exemption for monthly payments will be raised to 150% of the poverty line. An individual borrower makes up to $32,000 per year, and a family of four making less than $67,000 will get actually $0 monthly payments. The federal government says the number of borrowers eligible for those payments will total $1 million. Other changes this year include that unpaid interest will not grow if borrowers are making their payments on time still. Multiple other changes will occur next year in July, such as cutting monthly payments from 10 to 5%. Folks, money is arriving in millions of dollars of bank accounts. Many Americans will actually be receiving a monthly benefit today. Now, many Americans receive benefits from the Social Security Administration, but not all payments are paid out on the same day. The deposit date of monthly benefit depends on a number of factors. It's important to note that there are two types of Social Security income payments to look out for: SSI and SSDI. In addition, August 2023, the SSI income was already paid out on August 1st, for example, which was a Tuesday. Now, the Social Security Administration program seeks to face constant changes, especially lately. A new Social Security reform bill was recently introduced and could actually be notable changes next year. Republicans have claimed over and over again they're not trying to cut Social Security and Medicare, and the Republican Study Committee have just released its desired budget, in which the party seeks to make big changes to Social Security. The proposed budget would make cuts to Social Security by increasing retirement age for future retirees. The thing the document seeks is to assure that people would only be modest adjustments, but that does not what Republicans see. In a statement, the Senate Finance Committee, Ron Wyden, who is a Democrat, said the plan is proof that Republicans are committed to, as ever, cutting Medicare, cutting Medicaid, while allowing Social Security to wither. And also, Republican representatives just told reporters that they won't vote on any continuing resolution to fund the government past September 30th. This news comes as Congress readies for what could be a messy shutdown with the government. Representative actually cited his desire for current spending levels and promises for the House leadership to change.
Senator Sinema.
Thank you, Chairman Tester, for holding this hearing, and thank you to our witnesses for being here today. With over 500,000 veterans calling Arizona home, conversations around accessibility of veteran-specific health care are critical to ensuring the welfare of our state. Access to veteran health care services in rural areas is often limited, and it's necessary to come up with ways to keep our veterans from going without services simply because they can't reach the facilities that are able to provide them with care. In circumstances where non-VA emergency medical care results in saving these veterans' lives, they shouldn't have to jump through hoops to get reimbursed. And that's why I, with Senator Braun, introduced the Relieve Act to expand the eligibility for veterans to access emergency care from a provider outside the VA.
Everybody, we have a lot of news to go over in today's fourth stimulus check update, so you want to be sure to stay until the end of this video. And don't forget to subscribe to my channel and share this video with your friends and family. Now let's get into the very important stimulus check news. Crisis this year, folks, has brought with it financial hardship for millions of Americans, and federal governments have acted to alleviate the suffering that Americans have faced. And all this is done through the stimulus checks and the stimulus bills that were approved. Folks, in regards to the increase in your Social Security benefits, well, Senator Schumer, Warren, and Ron Wyden have unveiled a plan to increase benefits by $200 per month for all Social Security beneficiaries. The plan is set to provide more than 60 million Americans with an additional $4,000 over 2 years. It's all part of the Democrats' bold Phase 3 stimulus proposal. Yes, folks, this is great news. It looks like our Democrats in Congress are finally looking to help out our American seniors and increase the Social Security benefits. You support the increase in Social Security benefits, folks. Leave your thoughts in the comments below.
Now I want to provide an update on our efforts to help millions of Americans down south recover and rebuild from Hurricane Ida. We've been monitoring this hurricane closely and the devastation it's caused. To date, 6 deaths. About 1 million homes are without power in Louisiana and Mississippi. While the catastrophic flooding wasn't as severe as it was during Hurricane Katrina 16 years ago.
Now Chuck Schumer and Elizabeth Warren, as well as Ron Wyden, have revealed a plan to increase monthly benefits of Social Security, veterans, SSI, and SSDI by $200 a month. This would improve the lives of millions of Americans and help the economy stabilize. Now, the Democratic plan, everybody, would give seniors, veterans, and people with disabilities who have earned this benefit by contributing to Social Security, with every paycheck, an additional $4,000 over the next 2 years.
Thank you, Governor, and first, my condolences and heart and prayers to all of the families who have lost loved ones. Imagine the horror of you're sitting in your own basement apartment and the water just floods in all of a sudden with no notice, and you struggle to get out, but you can't. It's an awful, awful situation, and our hearts go out to them. I too want to thank all of our New Yorkers.
Now, Chuck Schumer said this: immediately increasing Social Security benefits will put money in the pockets of seniors, veterans, and people with disabilities during these uncertain times. So the Democrats are committed to quickly delivering relief to the millions of Americans bearing the weight of this public health crisis. And Elizabeth Warren, folks, said this: increasing Social Security benefits would get money directly to millions of people quickly, delivering immediate relief to Americans at heightened risk during the crisis and boosting our economy.
For center here, and thank you to the volunteers who are here and many who are not, but all of them important, because the public...
I've also joined with Senator Moran, our ranking member, in introducing the Health Act to ensure Arizona veterans retain the ability to make their own decisions around their health care, while also making much-needed improvements to the quality of care provided. And I look forward to working with both Senator Moran and Chairman Tester to continue to improve options for community care. My first question is for you, Ms. Thomas. Nearly every day, my staff helps Arizona veterans navigate an unexpected VA medical bill. What efforts should the VA implement to ensure that staff and community emergency departments are aware of the new eligibility criteria to prevent the veteran from experiencing issues or reimbursement delays? And do you believe legislation like the Relieve Act will help address the problem?
I do believe, thank you for the question, I do believe that the legislation